Palliversation, conversations in palliative care. What is palliative care? Palliative, this seems to be a fashionable word these days, but very few people, even if they are in medical field, have a clear idea as to what palliative care is. So is palliative care a new fleeting fashion? No, not at all. This way of thinking has aspired to become a part of the psyche of the medical profession. Yes, it's a new paradigm. As we all know, at one point in time, medicine was practiced in a paternalistic way with very limited resources. Then the experimental medical science took over, and medical armamentarium, if you will, got well equipped, literally got filled with many new drugs, including antibiotics, anti-cancer drugs, anti-cardiac diseases drugs, so on and so forth, raising the expectations of the public, imparting medical science almost a magical quality. At the same time, medical practice got inundated by multiple tests, blood tests, radiological tests, invasive tests, this test and that test. And before the doctors knew it, the test tubes and the x-rays became more important than the patients. Doctors nowadays feel obliged to order a test instead of relying on their clinical judgment. This made the doctor-patient relationship quite complicated than ever before. But the practice of medicine is introvert and dynamic. It keeps on evolving. It's a philosophical evolution, a necessary internal change, keeping in pace with the advances in medical science. This change is going to cloak the medical care in a very positive way. It is going to steer the medical system towards the patient. A patient-centered, symptom-focused system is called palliative care. But this is only an explanation, not the real definition. So let us ask a person who is well immersed in palliative care. This esteemed person is Padmashri Dr. Rajgopal from Kerala, India. He's the founder of a great organization, Pallium India, that is dedicated to the palliative care and is recognized internationally. Dr. Rajgopal was nominated for the 2018 Nobel Peace Prize. So let us talk to the guru of palliative care. Welcome, Dr. Rajgopal, to Palliversation. It's an honor and privilege to have you here with us today. I have a very basic question for you. What is the meaning of palliative care?
To answer your question on sentence, palliative care is prevention and management of serious health-related suffering. Serious health-related suffering has to be alleviated. We doctors are taught to diagnose and cure diseases. We were not taught how to identify elements of suffering and relieve it. We grew up as doctors without thinking that we have any responsibility to intervene in emotional or social issues causing suffering. So palliative care is prevention and management of serious health-related suffering, which then has to start when the suffering starts.
Exactly.
It can be even before the diagnosis. So this is the message. Unfortunately, globally, palliative care started by caring for the dying. That's what Dame Cicely Saunders did in St. Christopher's Hospice.
Yes.
So that association has stuck. Yes, you are quite right. If I say that I practice palliative care, oh, you do mercy killing, could well be the reaction. Maybe not in Kerala where it's more known, but certainly in most of the country. So we will have to keep on highlighting this point, that this is about suffering. This is about needless suffering, and that needs to be treated.
Thank you, Dr. Rajgopal, for talking to us today regarding this important topic. So the definition of palliative care by the National Consensus Project for Quality Palliative Care is an interdisciplinary service provided at any stage of a serious illness. By definition, a serious illness is an illness that carries a risk of mortality and either negatively impacts a person's daily life or the quality of life, or excessively strains the caregivers. What are the serious illnesses? Here is the list of serious illnesses. The first category is that of neurological diseases like amyotrophic lateral sclerosis, Huntington's disease, multiple sclerosis, strokes, Parkinson's disease. The other diseases which also fall into these categories are coming from organ failure, such as chronic obstructive pulmonary diseases, congestive heart failure, end-stage liver disease of any etiology, end-stage kidney disease of any etiology. Metastatic cancers, of course, AIDS due to HIV infection, and sickle cell anemia. And any other patient who has a prolonged, complicated illness, difficult to manage by a single doctor, they may be put into this basket as well at the discretion of the primary care physician. What is an interdisciplinary team? The interdisciplinary team consists of a basic team of a physician, a nurse, and a social worker. Hopefully, they're all trained in palliative care. And the ancillary services, such as a certified nutritionist, a physical therapist, occupational therapist, pharmacist, wound care nurse, and a chaplain, and most importantly, a volunteer. And a team of volunteers can do wonders to patient care. And if you're going to start your own palliative care, please be aware of it. Now, how do all these providers help patient improve the quality of life? They improve it by anticipating, preventing, and managing the complications of any chronic illness. Now, the palliative care team addresses the whole person, a personhood includes multiple dimensions such as physical, psychological, social, and spiritual. It takes a village to practice palliative care. So create one. Hope you find this episode of Palliversation thought-provoking and helpful. Please join us again. Thank you for your time and attention. This is Bhagyashree Barlingay from Phoenix, Arizona. Have a nice day.